Our cardiac rehab program is unique in that it is housed within a children's hospital with expertise in pediatric cardiology.
We used to think when people were sick that you needed to rest and stay in bed, and we realized that that actually is not the best sometimes. Kids with heart disease, even before their surgery, can get so much healthier and stronger through cardiac rehab.
I had my transplant last April the 13th, and I had a VAD for about a month and a half before that. So I'm about almost a year from getting my transplant. Rehab helped me get back to doing show choir because I like dancing. It allowed me to get a job because I was 16.
The cardiac rehab team works with inpatients before and after surgery. They also run a 3-month outpatient program. Everything the team does is individualized for a child's goals, which could be as simple as wanting to play with their friends on the playground again.
Not just about having a healthy heart, but it's about having a healthy life, and that's what cardiac rehab gives us.
We ask them what piece of equipment you feeling today, the treadmill, bike, usually just depends on the patient, depends on how they're feeling, and do that for 15-20 minutes, and one of us two or we both come up with certain workouts, 2 upper body, 2 lower body, 2 abdomen. And again, depending on the age, depending on what they're focused on doing, we want to make sure that they get what they're looking for.
We can see a patient who's preschool age, or we can see a patient in their 40s, but we have the right staff here and the right equipment to serve those different age groups and those different experiences.
For the younger kids, you have to try to trick them into having fun. We have a dice game. That's my personal favorite. We write the exercises on this dice, and then they roll it, and whichever one they get, you have to do it. Sticker step-ups is a crowd favorite. You just step up and put a sticker on a piece of paper on the wall, and we have so many stickers, it is crazy. We also have cars and ninjas and army men. I have a whole kid closet.
It's really enjoyable, and kids make you laugh, and we have music blaring. I always enjoy that.
After 17-year-old Ralph Creekmore had sudden cardiac arrest, his doctors suggested cardiac rehab to help him recover.
I thought, this isn't going to work. Ralphie doesn't like aerobics. He really hates exercise other than lifting, showing his strength, So I didn't think it would work, but after our first visit, he couldn't wait to come back to the next one.
I love this. This is my dream job. It is my favorite thing to see these kids so excited because they think they can't do something, and then they come in here and it's like, oh my gosh, Justine, did you just see that? I actually did it. That's my favorite.
Some of the cardiologists that are either new here or aren't as familiar with what we do will say, oh yeah, we know the cardiac rehab staff. That's the staff that's always yelling and encouraging patients in the hallway, come on, let's go. And I said, yep, that's them.
That was nice.